in the arena of HER2-positive disease. It's been, again, a somewhat eventful year. We had data that was presented earlier this year in Europe that showed that the Cleopatra study, which was the pertuzumab, trastuzumab, docetaxel trial, had a very firm, clear survival advantage, and that's the final analysis. So that really positions that combination of drugs very well for first-line therapy. One of the focuses, though, has been in patients who develop progression on trastuzumab-based therapies. Are there ways that we can overcome resistance? And one of the trials that was presented at this meeting, the Bolero-1 trial, looks at the incorporation of an mTOR inhibitor, which is important in a signaling pathway that may be responsible for trastuzumab resistance. And that trial really looked at first-line patients who are receiving a taxane plus trastuzumab plus an mTOR inhibitor, everolimus, versus just the chemo plus trastuzumab. And what that trial found was, in a sense, nothing that was all that remarkable. The addition of the mTOR inhibitor for the entire population didn't really improve outcome to any great degree. There were a subset of patients where there did seem to be some benefit, but for the group as a whole, it wasn't clearly evident. So I think that strategies for overcoming trastuzumab resistance or anti-HER2 therapy resistance still requires a great deal of work. Last year, we heard data with an mTOR inhibitor in yet another Bolero trial, the Bolero-3 trial, that looked at later lines of therapy incorporating an mTOR inhibitor. And unfortunately, that trial too failed to demonstrate clinically meaningful, though statistically significant result. It was only about a 1-month difference with the addition of the mTOR inhibitor. So you can show, in a sense, proof of principle, but does it really, when the rubber meets the road, is this making a difference in patients' lives? And I would argue that probably that is not a strategy that has panned out, at least yet.